whatever questions you have.
Okay. Hello, everybody. Wow, we haven't been live in a second. Welcome to Good Gut Live. This is your opportunity to ask us questions live. Part of watching Good Gut Live is you can ask questions in the chat below, in the comment down below, wherever you're watching this. You can ask questions. Today's topic is a really good one. It's very pertinent on things that are happening in the world. We are discussing, or the title of today is, do you actually have access to health? And that could be healthcare, that can just be your health. And so we're just going to be really discussing that, what that means, right? Does it mean, and well, I'll get into it, but it can mean so many things. So we're going to be talking with that on that topic today with everyone here. My name is James Marin. I'm an integrative registered dietitian, environmental nutritionist, one of the co-founders of Married to Health.
I'm Delia Marin. I'm a registered dietitian nutritionist, certified gastrointestinal nutritionist as well, and one of the co-founders of Married to Health.
And I'm Laura, and I'm also known as the Emotional RD. I am a licensed registered dietitian, and I specialize in women's health and nervous system somatic work.
Wonderful. So we're excited to be here. And again, the topic is very exciting. So I guess break it down by hurdles almost, where we have these barriers or these hurdles to health, right? Like, because really the question is why isn't everyone healthy? We spend the most money on health in the US. I mean, I don't go on social media or see a commercial if it's not a pharmaceutical drug or someone selling like we're going to see this a lot in the new year. Right now, we're not in the new year. Maybe if you're watching this on the podcast, the new year already passed. But the first 3 months of the year is like getting in the gym and this health bundle or this program. And so why aren't our numbers looking better? Why is diabetes so high? Why is obesity so high? So there can be these hurdles. And we could look at it as like health insurance, but only 8%, according to data, of people are not insured. So,
Of
okay.
Americans.
8%
of Americans?
Of Americans, yeah. So then 92% of us have insurance. We should be tip-top shape, right? Some say estimates are about 60% of those insured don't use medical nutrition therapy, so aren't seeing a registered dietitian. And then about 60+% of Americans who have insurance say they have some sort of issue with their insurance. So for those of you that have health insurance, this is like a claim didn't go through. We see this, sometimes in our practice, we get it. Insurance isn't perfect. Your deductible, a claim is delayed, it didn't go through, you're having to pay out of pocket, or you have a big copay or co-insurance, and you're like, what the heck? I pay for my insurance every month. Why am I now also paying out of pocket? Whether it's $20 or $200, that matters, right? So that can be an obstacle for sure.
Some people are paying upwards of like $2,000 a month and still struggling with getting things covered. And, I remember I had the opportunity to really learn a lot about insurance just because growing up, my mom had a lot of health issues, and I just always heard her on the phone with her insurance, and she was just always flustered, like, the insurance this. And my parents had like 2 or 3 types of insurance. And so she was always talking to one of them and fighting a claim or a deductible or copay or something. So I had the unique experience of very early on in my life hearing a lot about insurance. But then I remember meeting James, and he was like, I've never heard a word about insurance in my life. Like, I have insurance, don't really use insurance. So like, it's been interesting now that we also have a practice who is in network with many of these insurances, including Medicare. And now we see the back end of being providers and sometimes being the ones who unintentionally are the source of frustration for people because of some of these hurdles that we have with insurance companies. So if you've had any of these experiences, whether you feel like you're an insurance pro, you're maybe a novice, like James came into it as, I know Laura was saying, like, I have a lot of questions about insurance. There's a lot. I feel like there's a lot to know about it. So we want to hear any of your experiences, and it gets really nitty gritty. And sometimes it can feel very unfair. We've had instances with people, patients, family members, where they're like, I had to go have an emergency surgery. right? I can't choose my doctors. I can't call my insurance to verify if my surgeon and anesthesiologist are in network. And sure enough, they're out of network. So now I owe 20 grand. So there's instances like that where it's like you didn't have a choice or time to choose differently if your appendix is about to burst or your gallbladder or something emergent like that is happening. You just go to your local hospital and you assume I have insurance, so everything will be fine. Or we've had instances in which patients said, I didn't know my insurance carrier had a contract with this specific lab, right? I didn't know that I could only go to LabCorp or I could only go to Quest or one of the others. And I went to one that wasn't in network with them, and now I owe $4,000 for my blood work. So things like this happen really often with people. And again, it's frustrating when you're like, I pay $2,000 a month for my insurance, or I pay $1,200 a month, or even $500 a month, and I still owe this much money. I feel like health insurance is a lot more convoluted than other types of insurance because you can have homeowners insurance or car insurance. And in our experience, that's a lot more straightforward, right? You call, you're like, hey, Geico, I had a car accident. They really take over and they're telling you this is the auto body shop that you go to and this is the information we need and we're going to run our investigation and then we're going to tell you how much we're going to pay you or whatever. You know exactly how much your deductible is. You know what to get into. With health insurance, I kind of liken it to taxes, where with taxes it's kind of like, I don't know, guess how much you owe me. If you get it wrong, you're in trouble. So health insurance is just unfortunately more expensive, more stressful, and a lot more convoluted, in my opinion.
Well, yeah, and so again, and this is yeah, obstacles, and that could be just as much as we want to think health insurance is a way for people to get access, and it can be, and it is sometimes. It can also be this obstacle where it creates more of this headache, and it creates more of this just, I guess, unease when it comes to something you're already experiencing dis-ease with. You have a
Mhm.
disease, it's dis-ease, and now you're just trying to get help and it becomes this big other headache, right? And so and that's what we're exploring is like, there's been some headlines, there's many different layers to this, but one thing that kind of spurred this topic was the idea of Medicare, and the idea that as of January 1st, Medicare is going to be limiting telehealth services.
Proposing.
Oh, it's proposing, so it's proposing to limit. So but starting, what the verbiage they've said is starting January 1st, it is limiting telehealth services. And some things can change. There's bills, and this is where like people can glaze over and just go, oh my gosh, this is giving me a headache even just talking about it. And where it's like, okay, legislation and Senate bills, and who controls Medicare, and why should I Medicare? Who cares, right?
Yeah, you might be thinking like, I'm not 65 and over or disabled. Medicare doesn't apply to me, but it does.
It does. It really does. Because on so many levels, one, you're paying for it. So if you ever look at your check, part of what you're paying for is Medicare. It's not just taxes coming out of your check. It's not just your insurance or your 401k or whatever. It's going to Medicare.
We all
Medicare
pay into it.
is a federally funded, basically healthcare for the elderly that we're all paying into. However, it's projected that for our generation, by the time we get elderly, Medicare might not have any funds left, right? We're facing a massive deficit. So this goes into many different layers of this topic. But to stay focused and on topic with this, because it's huge, it's you should care because one, you're paying for it, and two, it can affect someone you love. I mean, we all know someone who's elderly, I would think, or
Or
most of
disabled.
us, or disabled.
Mhm.
And so they could need that care. And then third, and this is where it's like, it seems to be common sense for me, and we'd love to hear your opinion as well, or just anyone watching, or definitely Laura. But like, third is this idea that it's 2025 and we're limiting technology that can help people get more care and access.
We're reverting back.
Why? Like, what is that? And
Mhm.
as if there aren't already, I mean, just talking about insurance in and of itself alone, there already seem to be so many hurdles why are we almost actively trying to make another one?
And for those who aren't familiar, Medicare sets the tone for all others. So you might be thinking, I don't care. I have Blue Shield. I have really good insurance. Once Medicare creates mandates, other insurances tend to fall in line with whatever Medicare is doing. Medicare
Mm.
really sets the rates for practitioners. So all the other insurance companies base their reimbursement rates, or basically how much they're going to pay us as providers and other types of providers, based on whatever Medicare is willing to pay us. So Medicare is often used as an example for any of the other healthcare providers or insurance payers that you might have. So it's important for people to spark these conversations, think about these conversations. But Laura, we'd love to hear kind of how you're taking this all in with what we're saying, and just what initial questions come to mind if you have any, or concerns.
I think for me, it's important that accessibility. So yes, while this is affecting senior and rural communities, there's one thing for real, it's that we're not getting younger, right? So this will affect us eventually, because hopefully we'll get to that place. And so that's why we have to be caring about it. Like you were mentioning, I'm glad that you mentioned that. It's important to realize that Medicare sets the tone for many of the insurance practices. So even though right now you feel like you're not affected by it, it's a trickle effect.
Right.
And yeah, losing the accessibility of health it's an issue. Like, I think in the United States, especially, we know and we're seeing numbers that we're struggling when it comes to health. Like, we are struggling with health, even though with all of the things that they're putting in, like insurances and programs and stuff like that, and we're still struggling. So yeah, it's just one of those things that you start to wonder, are we really using our resources in the best way possible and efficiently for our population?
Mm.
Or I know this can become a little bit of a conspiracy kind of conversation, but are we really trying to make a population sick? Like,
Mm.
what are we doing here? Like, there's so many questions to pose and reflect
Mhm.
upon, because a healthy population is needed for the generations to come. And if we're not doing this right now, and instead we're falling back into not using the technology and telehealth and how accessible it is for everyone, even in the aspects of mental health, how
Mhm.
how much did all of this telehealth stuff uh, expand and increase the accessibility of many people going through lots of mental and emotional issues through COVID, for example, and
Mhm.
situations where people were locked down and the only thing that they had was, telehealth and the possibility to talk to a provider from the comfort of their homes. Not
Mhm.
only that, now you're having to, the stress of like traffic, cost is going to increase, providers are going to, be hit as well, because, not all providers are big companies like insurance companies that they have tons of partners and like in clients and they can just do whatever they want. No, like, there's tons of small business owners, like Married to
Mhm.
Health, for example. We're small business
Yeah.
owners, and this type of decisions really trickle down and affect the people that small business owners, people that lives in the community outside in the rural side, senior, the most vulnerable people.
Mhm.
And so it's very frustrating.
It is. No, and well, this begs the question, right? Like, our true access to health, because maybe you have it all. Maybe you're like, oh, I don't have Medicare. I have great health insurance, and I live in a great area. I have a car. I have money and means. But do you still, even then, there are many people like that who still don't really consider themselves healthy, right? Or analytically, or are looking at it objectively, are they actually healthy? And the answer is no for many of those people. So even if you have all the means, there's still like this gap. And I think you're touching on it, Laura, where it's like, why are there food deserts, which are essentially no access to like fresh fruits and vegetables and plant foods? Why are there food swamps where it's just inundated with Arby's and McDonald's and
Ultra
Jack in the
processed
Box. It's
foods.
ultra processed food. So it's great. There's food options, but it's all just ultra processed foods. Like, how did we get here, right? Was this by design? And this almost goes into that. I guess you can call it a conspiracy, but really a conspiracy is just this, you're connecting dots. You're connecting, I guess you can call them coincidences, but you're seeing kind of this rhythm and this pattern play out. And we've kind of given it a negative connotation as a conspiracy, but really you're just seeing a pattern where it's like, okay, it's easier for me to get ultra processed food that makes me sick. It's easier for me to see a pharmaceutical commercial. It's easier for me to have a headache when trying to use my health insurance. It's easier for me to be stressed than at peace. What have we done here? What are we creating? These are now obstacles to my health. Why have we not created less obstacles to this house? Why isn't we could just reverse all of what I just said, right? Why isn't it the default for me to be at peace? Why isn't the default for me to be healthy and just go outside my door and find fresh food?
I think we're unearthing an existential.
No, totally. But this is it. But this is something you can think
It's
of it as a
all
very
relative.
easy. My insurance. We'll talk about insurance as an obstacle, or you can think of all these bigger things, right? But it ultimately leads to the question of having access to health, right? And do you really have it? And
I think it comes down to also appropriate use of resources, right? Where like
Mhm.
we're also the country who has the greatest data and the greatest resources. I can't even tell you how many of my patients have a Whoop and an Aura Ring and an Apple Watch. And so
Yes.
they have all these data points. And so many people have access to these things. And again, we're not seeing an uptick in, or I guess not a strong uptick in the metabolic health of our nation overall, the
Mhm.
mental health, the physiological health of our nation, the gut health of our nation, certainly. So it does beg the question, do things like this, right? Whether we can solve the world's problems or not. But, our question today is, do you actually have access to health? Like, even if you're somebody who has Medicare, who has a great PPO insurance, has maybe an HMO or, Medi-Cal or whatever your
Who's working
state's
with Dahlia Marion,
option
RDN?
is.
No, I'm just kidding.
But, have you experienced any of those barriers to care? And are any of these changes going to trickle down and affect you? I think this is a relevant topic, and it's interesting because we had this topic planned actually for the last few weeks. And then there were some headlines this week in the news
Mhm.
regarding insurance payers and healthcare and just some really difficult things that have been happening in the world. For example, we heard that unfortunately the United Healthcare CEO was murdered, and they're feeling like it
Mhm.
was a preemptive murder because they do think that this person was either affected negatively by United Healthcare. They had some type of premeditated motivation to specifically target this man, unfortunately. And it's really sad. I've actually been seeing a lot of people kind of praise this and say, like, oh,
Mm.
we need to reform our healthcare. Certainly we do, but I don't think that we need to do that by literally taking somebody's life. But it just goes to show someone is willing to commit murder for how
Mm.
dissatisfied either this person was or whoever hired them was with what either United Healthcare in particular is doing, with insurance payers in general are doing. So whether it was that example, or we had a lot of people also talking about Blue Cross Blue Shield, who was trying to cap anesthesia in
Mm.
New York and Connecticut. So they were trying to say that we're going to allot a certain amount of time for each procedure of anesthesia. And if the procedure goes over, we're not paying for any more anesthesia. The patient will be liable for that. And so, rightfully so, a lot of patients and practitioners were speaking out against this. And just like 2 days after they announced this, or maybe even one day, they actually took it back and they're like, okay, never mind. We made you really upset because there's so many extenuating factors. A person's body mass index plays into how much anesthesia they need. What if there are complications during the procedure and it extends the length of time? Like, how can you try to put that pressure on practitioners? So, yes, we get it. all companies, including insurance companies, need to be mindful of costs, but not when it costs lives and not when it costs the mental health of our providers who are willingly signing contracts with these insurance payers and going into network with them, and then just feeling like we are bullied and downtrodden by these insurance payers. So it's been an interesting week, and a lot of people I think are thinking about insurance more, certainly hearing about insurance more,
And
talking about insurance more with these three specific examples.
with this conversation, it also poses the question of, not everyone may have, like, maybe like you said with the stats, many people has insurance, not many people use the insurance.
Right.
So what are we doing with this money?
Right.
Like, how are we managing this money so that the purpose of having insurance is to, like, get covered whenever we do need it. But if we're now trying to cap things that, sometimes we do need more anesthesia and in other procedures, like, I guess it just poses the question of, who is the treasurer? How are we, like, splitting the money, and what are we doing with the money that we're paying for our insurance? Because, it becomes a moral thing now, as the consumer that we're, like, purchasing the insurance, you're like, okay, feeling a little bit better that whatever happens, you're going to have something that will cover you. But now with all of these stipulations, they get to decide that. And it's like, it's very unfair. It's like, okay, but how about, let me see what you're spending, kind of like an auditing almost. Like, what are you spending your money in during the year? And how can we, like, maybe you don't need such a fat check, at the end of the year. How about you just actually give and pay more to the people that is actually working long hours and paying for insurance monthly to get the care that they need? So I don't know, it just poses a lot of questions. It's almost like, even with my tone, it makes me angry if you can see it. But I just think it's crazy that we're even paying with our taxes, like to Medicare. And then eventually this will be gone. So what are we paying for our taxes then?
Yes. And given the fact that, I mean, look, when we look at insurance company CEOs and how much they get paid, and on top of that, yeah, we're talking about the American tax dollar going to then subsidize a lot of this, which is insane. And then you're looking at the fact of denial rate. I mean, there's so many questions here, and I think that's where our generation's growing up and asking these questions and going like, what the heck's going on? We can't just continue business as usual because it's no longer productive to do that. We're asking these questions again. These are obstacles to our overall health, and we need to be asking these hard questions. They're uncomfortable. They're hard. I want to put up this here, which is showing the health insurance claim denial rates for in-network. So these are people who are in-network.
And this data is from CMS, the Centers for Medicare Services. So this is a government organization that put out
Interesting that United Healthcare is up there, huh?
Yeah.
And that's, I saw this
call it
posted a lot
coincidence,
this week.
Call it coincidence. But yeah, I mean, you're looking at people who are upset, who are angry. You're looking at the number one cause of bankruptcy being medical related debt
in the United States.
And so you're seeing this where it's like you're doing everything right. You have a job, you're paying into health insurance, and yet your claim is still being denied. Like what is wrong with there, right? Something is happening here, and we can chalk it up to greed. And for those that are just listening, I'm putting a graphic on, and we've been putting up the articles we've been talking about, and we put on this graphic where it's just showing United Healthcare is 33%, at least in 2024, for in-network denial rates when it comes to a claim. So this is like, I want to see a dietitian.
Or even, they can deny things like, if your provider you're working with says, okay, this is the best treatment for you, we need this medication for you because this is going to treat your symptoms, they can deny it and say, nope, we're not going to cover it. I saw an example of a physician wrote an appeal to the insurance company because they were treating a child with cancer, and the insurance company denied anti-nausea medication for a child who was going through chemotherapy. We know that that's a common side effect of chemotherapy. So they can deny these things that you really will need for the condition that you have going on. And it's interesting to just observe their denial rates to see, okay, a third of claims made or referrals made are denied. So whether that's I already saw the provider and now you're telling me you won't reimburse or you won't pay that provider, so now I have to pay the provider, whether that's my physician put in a referral for an MRI or an X-ray or a blood test that I need in order to receive proper care, and you're denying it, saying, no, I'm not going to cover that for you. So these are all things I think it's just important for people to know are out there. Again, it might not apply to you right now. You might be in perfect health, and I hope that you are. And this might not be applicable to you right now. But in the future, if you or a loved one are dealing with any health issues, these might be things that are affecting you that you should know about. So just knowing the questions to ask, like, what is usually covered and what is not? What is in my benefits package with my insurance? If my employer is paying into it, how can I involve my employer to advocate for me? Because if your employer is paying a percentage of your insurance, a lot of the times they get a discount package from the insurance. So if you have claims that are denied, sometimes you can talk to HR and HR can help you connect with the right person from your insurance to advocate for you. Um, so there are instances like that as well. If you're getting frustrated, if you're like, I need this care right now, I'm not getting anywhere, call your insurance. Sometimes they'll provide you with an insurance advocate, or again, your company will provide you with an advocate to just help you ask the questions that maybe you didn't know that you should be asking, whether it's before or after the fact. Hopefully, it's beforehand. But yes, we as receivers of medical care, recipients rather of medical care, have been impacted by these things. We as providers of medical nutrition therapy care who have decided to go and network with insurance are impacted by these things. We know that a lot of you are impacted by a lot of these things because you tell us that you are. So we want to know, like, what does this spark up for you? We're not trying to bring up mass rage. But we just want to kind of bring up this topic. It's relevant. You're coming to the end of the year as well. So you might have been all caught up on your deductible. Maybe you met your deductible for the year in these last 3 weeks of the year. Maybe you're trying to see all of your medical providers because you know, okay, my insurance is going to pay for it from here on out for the most part, depending on your coverage. So this might be the time that you're asking these questions. So we hope that this kind of planted some interesting seeds, at least in your mind, to say, what do I even ask? What do these things mean? What is a copay? What is a deductible? What is coinsurance? What is an authorization, pre-authorization? What is a claim denial? Like, what do I need to know about these things? So I don't end up getting a bill for 20 grand, or I don't end up getting a $500 bill that maybe is going to push me over the edge. So yeah, we hope this kind of sparked some interest in all of you.
And so the focus has been a lot on insurance, which so please make sure if you're not already subscribe at mary'shealth.com to our email list so you can be the first to know about a blog. We are writing a blog on this very soon that'll be coming out likely at the beginning of January. And so this is going to be really our push and our really process to help empower all of you and to really just educate you and have insurance be just one less obstacle, because insurance should be there to help you. And I know, like Dahlia's saying, there's a lot to get angry about, right? When it comes to insurance, let
If you
alone
choose to get angry.
if you choose to get angry,
You don't need
let
to.
alone other things. But again, we want to bring it back where, yes, we could talk about Senate bills and decisions being made. And yes, we can take action on that. But most important is you taking action individually, is you feeling empowered and educated and you advocating for yourself and you making decisions to see, is my healthcare even right for me, or my health
Mm,
insurance, is it actually working for me or am I working for it? And if that makes sense and what that means for you. So it's very important to understand that, you do have the power, you have this level of responsibility, first and foremost for yourself, and then it can go above and beyond outward into legislation if you want to take action and call your senator and sign petitions, which we do have a petition link in our bio down below. And you can sign this petition when it comes to Medicare and take action there, which is great. But again, first and foremost, it starts with you. It starts with you being healthy. It starts with you really making a decision to go, am I making my health and being healthy a priority? Am I reflecting that in my actions and what I do on a daily basis? And then just kind of leveling up and going from there, because yes, this can get into so many different avenues and so many different ways. But again, we're here to just speak on the way we see our patients really finding success, how we can empower them and really overcome these obstacles one by one. And really, it's unfortunate to really say health insurance is an obstacle. I mean, the whole point is for it to enable access. So I think we want to get to a place in the future where health insurance is truly health assurance, right? It's not just insurance, but it's assuring your health. It's helping you get healthy and it's really working for you. But yeah, so important.
I think education is just a key piece, and it shows how important it is to take responsibility and really put in the investment and the priority as your health. Because if you are working towards this every day, you'll have less likelihood of having to use the insurance and just use it for emergencies.
Yes. Right. And that's the point where it can be emergency. Like there are big emergencies, like with you get into a car accident, you need life-saving care. And I don't think anyone's expecting you to go to a holistic doctor after a car accident, your arms hanging off and being like, I hope these herbs help and they're much cheaper or cost effective. It's like, no, you're going to go to emergency room. But even then, I mean, there's a lot there where even the costs, like the prices we're seeing for even saline solution is marked up 500%, and we're seeing all these costs increase. And it's like, again, that question, like, why? Like, why is this happening? Why are we seeing this? And to go back from that hope, I want to show this just before I forget. But to the point before, I think this is a reason why, where we're looking at. So if we're looking here at the highest paid health insurance CEOs ranked, we are seeing, let me decline that. Molina Healthcare, Joseph Zubreski, total compensation is over $22 million, right? And when it comes to CEO pay ratio
to their
employees, it's for every 278 employees is like it's paying him, right? So it's out of control. Next on the list, we have Karen Lynch of CVS Health, right? So when we're thinking of access, I mean, we see CVS. I see CVS almost on every corner. So we think, yay, access to, they sell supplements and drugs, and great, people need that. They need their insulin. But when you're seeing the CEO pay ratio be 380 to 1, where you're seeing Lynch earned over 21.3 million in total compensation in 2022.
Well, it's interesting reading the breakdown. Like her annual base salary is $1.5 million. And then interesting, they're earning millions and millions of dollars in stock incentives. So what do you think these CEOs are investing stock in? They have insider information about most prevalent diseases. So then if they're investing in things like, I know cancer, let's say colon cancer is the fastest rising cancer in people ages 20 to 50, I'm going to invest in these colon cancer drugs. And I'm going to make $12 million a year. So it's interesting also to see, like, is there an ethical aspect to this that you really want to consider?
Well, just on that really quickly, I mean, there's some of that, but also a lot of CEOs get stock packages of their company. So in the company, they get pay of 1.5 million, and then the rest is in stock options. So when CVS stock goes up, when the company, or even there's parent companies that own CVS, when that stock goes up, their pay increases. But again, the incentive is the stock to go up. How does the stock go up? Well, the stock goes up. Well, the stock goes up by profits increasing. How do profits increase? Well, you deny claims. You'd say anesthesia should be limited, right? You cut all these corners so that your revenue increases. You make it more difficult for your again, your customer to get the care they need, because that means you're paying out, not retaining those earnings and that money. So in order for their, again, revenue to go up, they're usually trying to get more people to buy in and also cutting those corners. It's just like owning a barbecue restaurant or something, right? And it's like, instead of getting the most organic, amazing veggies and rice and sides and all these wonderful ingredients, you're just cutting corners. You're going to the cheapest, most disgusting places to get this food because it's pennies on the dollar, and you get to increase your profit margin. So it's annoying, it's disgusting. It does kind of circle back to
I have
greed.
strong feelings about
I
it.
do. I mean, it's the truth.
It's interesting. And again, I don't think that our system is perfect, but also I don't think universal health care is perfect either. And I hear this from
No.
my patients who live in countries with universal health care. So I have patients who live in Canada and the UK and in countries where they don't have to pay directly for private insurance. They are paying for just universal health care, and they still have issues with it. They have long wait times. Their providers are compensated a lot less than providers here in the States are. And so there are long wait times. Specialists are few and far in between. So we don't want to just complain here, but we want to just bring some of these topics up, because if it's something that we're thinking about, we're sure it's things you're thinking about. We see here that we have a question. Somebody is asking us, healthcare professionals, what can we do to empower our patients and help them navigate health insurance? So many people are intimidated with the complicated process and insurance lingo. I think this is a fantastic question, because we're not here to just complain and stress you all out. You're stressed enough.
Yeah.
But we want to provide you with tangible takeaways. So one of the things I always encourage people to do is be mindful when you're selecting your insurance. I know when I was employed in the past, I would get, at that time of the year, usually it's in fall, you have that what is it called?
Open enrollment.
Open enrollment.
Mhm.
And you get maybe 4 options for which insurance you want to pick. Really sit down, look at your options, and I would say look at your practitioners that you're working with. Um, See who they're in network with, if they are in network. If you're working with a bunch of practitioners who aren't in network, maybe then you just have disaster insurance, where you have a high deductible but a low monthly payment. And that's just in case you get into a disastrous car accident or you need an emergency surgery. Sure, you'll pay maybe $5,000, $10,000 for your deductible, which is the amount that you need to reach before insurance kicks in, but that might not even happen. So if you're paying out of pocket anyways to see specialists because you have a special thing going on, maybe that's what you need to go with, instead of picking the best insurance coverage, but your providers aren't even in network with them. So maybe you're paying a lot monthly and you have a low deductible and a low copay, but you're not even going to get to use it. So I would say write out who you need to see, who is in network with what you need to see. Yeah, testing.
Philosophies,
Yes, absolutely. Does your practitioner kind of support what you need? Testing,
alternatives.
alternatives. And someone's mentioning testing. Like, do you need testing? Is that in your insurance network? Breath testing, or, parasite
Specialized
testing,
testing.
or not even just like lab testing.
Yeah.
There's more and more insurances now who are not even covering basic labs. So what types of tests or imaging are in network with you? If someone in my family was just diagnosed with something and they're going to need a lot more medical care next year, what type of coverage do we need to have? And then once you select the right insurance for you, really read into your policy. I think people assume United Healthcare is a blanket policy, Blue Cross Blue Shield blanket policy, each payer blanket policy. No, every single hundreds of us who are even listening to this right now, we could all have Aetna and we could have 100 different policies. Because again, if your employer is paying for part of your coverage, they dictate also what's covered and what's not. So you know what's covered with your policy. If I'm going to get blood work done, do I need to go to a specific lab? If I need to go to a hospital, which hospitals in network? What do I do if a claim is denied? How do I appeal that claim? Do I have an advocate who can help me navigate some of these things? So know your rights, know how to access your patient portal, know where to find that customer service contact number, know how to file an appeal to a claim so that way you can fight things if they're denied. But really know
Yes.
what these things mean. I really encourage you to, and you can call the insurance, they can explain these things to you. You can go on their websites, but that way you know, what is a copay? What does that mean? What is my copay if I'm just seeing my primary doctor versus if I'm seeing a specialist? Do I have preventive benefits or is it non-preventive benefits? What differs there? So know all these different layers that you might need to pay into, because there are support programs as well. For example, oftentimes I have patients who maybe they had a certain medication that was denied by their insurance, a prescription motility agent that their gastroenterologist prescribed to them. Sometimes I'll say, hey, contact the insurance, or sorry, the manufacturer itself, the medication manufacturer. They can sometimes give you a coupon, and instead of paying $800 a month, it's $20 a month. So talk to your dietitian, ask if they know any tips. Like I love when I can give those tips to my patients. Talk to your doctors. Again, we're on the other side of it. So a lot of times we know some of these loopholes. Talk to your insurance reps, do your research.
The
Because
easy one
again,
would be your HR department. If you're part
talk
of
to
a
your HR
company, your HR
department.
department has packages and resources for you to help you navigate all of this, and they can be your advocate in dealing with the insurance company. So you have these resources.
If
Yeah.
you know, like I'm having a baby next year, ask what's my coverage for prenatal care and what's my coverage for perinatal care? What's my pediatric, like try to anticipate whatever you might need, or again, find out what your emergency disaster coverage is, because you can't heal with each meal if you're so stressed out by your insurance bills that it's affecting your nervous system. So
Or if your insurance
knowledge
bills are
is
making you
power.
go, I shouldn't buy this organic food, or my food's or the kombucha is a little too expensive because I have to pay my insurance premium. Like if
Yeah.
all that's happening, it's kind of defeating the purpose, right? And we wanna look at these preventative measures, which is nutrition and lifestyle, as
Mhm.
opposed to just being like, I'm paying so much for my health insurance, when then it's limiting your health.
Yeah. And then I think last month, James and I did a live on
Mhm.
alternative options. So if you're hearing this and you're like, that sounds like a mess. I I don't know about, regular insurance. Last month we actually did a live and we talked about alternatives or just supplements as well. So things like health share. So that's an option if you want just a health share instead of health insurance. That's an option to look into. We talked also in that live, which we
FSA.
can link in the comments. FSA, a flex spending account, a health savings account you can pay into to cover costs of other things like ancillary providers that might not be in network with your insurance, like an acupuncturist, a chiropractor, a dietitian, or even things like eyeglasses, dental work.
Supplements.
Yeah,
Mhm.
supplement. So if I would say you might have some good questions from watching those too. But hopefully this was helpful for you. Laura, how do you feel? Because I know you came into this, you said, I'm going to have my own questions. How do you feel after this conversation?
It's pretty overwhelming, I have to admit.
Mm,
Yep.
But honestly, the best way to learn is to apply. And
Mhm.
really, like, for me, it was like this year having to apply for my own medical stuff. That's when I really had to get into, okay, what's my insurance look like? Oh
Mm.
my goodness, the deductible. Okay, learning about the deductible and the copay and really understanding. And then, like what you were saying with the open enrollment, sitting down, really like reading all of them. What are the options? What are my philosophies? Because that's an important one for me. If I tend to lean more towards alternative care, insurance is not going to cover most of that, to be honest.
Mhm.
So then why would I pay the max of the insurance if I'm going to be spending money out of pocket anyways? So then that's how I, like I would use some of the things that you've already mentioned with, okay, maybe just something that can cover for accidents, and then just an HSA account where, like at least you're putting some money into that, which has some tax benefits, and then you can pay, your out-of-pocket expenses to the medicine that you actually believe into, or like have more resonance towards. But that only came with me because I had to use it. And I had no idea, like, unfortunately, like sometimes it's just, we can say all of these things and you're just like, yeah, I'll get to that. But until you have to use it and really get yourself, your hands and your feet dirty with it, I don't think you can really embody the knowledge or really understand. It's really hard to understand it from a mental, logical level because there's so many pieces and angles. So just to answer your question in short, it's overwhelming. But I think you gave really good recommendations about reflecting, sitting down, knowing what your beliefs are. How is your overall health in general? Will I really use all of these things that, the insurance covers? And if you start answering questions, and then you can start like targeting what really is the best for that period of time. And then you can use supplemental stuff like you were using. So yeah, it's just a little bit of getting curious, sitting down, actually kind of like planning or meal prepping. You just have to do it. It's not very fun sometimes, but you just have to sit down and do it.
Right. And that's where I maybe one of the last points will be, don't let you, for anyone listening, watching, don't let yourself be the barrier. And so if you are experiencing symptoms, or if you're feeling unwell, if you're not feeling like, I know I could be healthier, don't let your lack of knowledge or your maybe, I mean, we all can be a little ADHD where it's like, I can't sit here and read this or listen to this, but it's like, if you really want it, I mean, it will take work, right? We do this all the time, whether it's our SIBO IBS program, whether it's Laura's emotional release visit, or you're working with Laura 101 or Dahlia 101 or any of our dietitians. If you want to do it, you're going to do it. If you want to prioritize it, you're going to prioritize it. It's going to take work. It's not going to automatically just happen on its own, but it's worth it. And if you prioritize it, if it becomes very much so at the forefront of your priorities, then you have to take that leap. You have to just be like, you know what? I want to be healthier. I know I can. I was just talking to a friend recently who was like, wait a minute, you mean you can reverse high blood pressure? You mean you can kind of reverse high cholesterol? And I was like, yeah, of course. And he's like a family friend, and he's kind of been around us and kind of followed us for a while. But you see like how it can become so alien and foreign, where it's like, yeah, you can do this. And he's like, wow. He's like, I never knew this, right? So it's, once that like it finally sinks in and that light bulb goes off, you're like, okay, let's do it. And you will see amazing things happen, right? So overall, that to say, don't let yourself be the limiting agent in this, whether it's you changing your insurance, you getting more knowledgeable about your insurance, or you eating healthier, or moving, whatever it is, learn about it, focus on it, do it, take that action, right? Move to the next phase of taking that action. So yeah.
So understand your insurance so that way it can help you heal with each meal. That's our recommendation.
And not be an obstacle. Yep.
Or
totally.
understand your options.
All right. Well, this was this is a much bigger topic, I think, than I initially thought, where it was like, yeah, we could keep talking about insurance for so long. And another comment coming in, there should be more education on insurance. 1,000,000 billion % there should be.
And some of the, financial literacy institutes, like you have things like the Kaplan Financial Education, the Khan Academy has some information like that. If you're curious, there are resources out there, but I think that's a good foundation. Next step is calling your insurance, talking to your HR, and then ask questions to your providers. Most of the time, the front desk people know how to answer some of those questions. Ask the questions that you need to feel comfortable, to feel as prepared as possible. We can't prepare for everything. Life is unpredictable, but hopefully this just gave you some more questions to ask, if not answers to walk away with. But let us know what you thought about this topic, what else you want us to speak about next time. This was something that was requested. But let us know if in the
news.
future you have specific topics, because you guys see we're open to talking about a large variety of things because they can affect your nutritional wellness. Even though they seem unrelated, everything is intertwined.
Mhm. All right.
All right.
Well, thank you, everybody. Until next time, heal with each meal, and we'll see you again for another Good Gut Live. And remember, you can watch this recording wherever you watch podcasts. So thank you if you're listening to Spotify, Apple, iHeartRadio, and links to information we talked about will be below in the description, so you can click and connect.
And don't forget to feel with each meal. Laura is somebody who can help you do that. Laura, where can people connect with you outside of through our Married to Health network?
Married to Health, Instagram, LinkedIn. Those are some places you can find me. Just come, don't be a stranger. Send me a message, and
Love it.
All right.
All right.
Wonderful.
Bye, everybody.
We hope you have a great rest of your